Well, it's almost time for open enrollment for Medicare. In fact, it starts October 15th. But if you're not sure what that means, or if you're just now getting ready to begin to use Medicare and you have some questions about it, that's perfect. This will be a great opportunity. So stay tuned and get all the Medicare answers you need. Stay tuned. Good morning, everyone, and welcome to Scan FYI. Yeah, today we're going to talk about Medicare because it's almost time for the annual open enrollment, which begins in October, actually October 15th. And that's an important date for everyone who is on Medicare. So who better to discuss that with me is Lauren Feldman. She is from Braven Health. So good morning, Lauren.
Good morning, Andrea. Thank you for having me.
Oh, thanks for being with me. And, you know, it happens every year, Medicare open enrollment, but every year I feel like people, well, there's always new people coming into Medicare. So I think this is a great thing to do on an annual basis. So why don't you just, if you would, just tell people a little bit about who you are, what you do for Braven.
Okay, so again, my name is Lauren Feldman. I work for Braven Health. I'm a community events coordinator. So I help to set up and coordinate all of the events that we do throughout the state. I am also licensed to sell Braven. So that is what allows me to talk about things like benefits and also just to even speak to Medicare and how it works and this Medicare 101.
Okay, and of course, we're talking in general terms today about Medicare 101, but I will put Lauren's contact info in the comments. So if anybody wants to reach out to her very specifically for Braven, we'll make it easy for you to do that. Okay, so just for someone who's just getting into Medicare, so what is the age now? Who is qualifying for Medicare?
So you qualify for Medicare when you turn 65. So it's important for people to really understand this because a lot of people, I think, are used to receiving their healthcare coverage directly through their employer, where the employer picks the plan, administers all the benefits. So there's not really that much responsibility on your end. But when you retire, that responsibility does become yours. So that's why it's really important to understand. So in order to be eligible for Medicare, it's for people over the age of 65 or people under 65 who have certain disabilities or like chronic diseases. But the majority of Medicare is for people 65 and older.
Once you go on Medicare, is it accurate to, once you're of age for Medicare, Lauren, is it accurate to say that you would no longer be getting health insurance through your employer, that you would be strictly a Medicare client?
So that really depends. And this is a lot more popular now since people are working beyond the age of 65.
Right.
So it really depends on your employer and the size of your company. That would really determine if Medicare is primary or what you need to do. So I would say anyone who plans to work past the age of 65, when they're approaching age 65, reach out to your benefits administrator for your job or human resources and see if they do require you to enroll or sign up for Medicare.
All right, so that's a good point, actually. And you know, you're right. You do have more responsibility here because your employer is not doing this for you. So you've got to step up on this one yourself. Yeah. Now, another question I'm going to ask you is: do you have to use Medicare? Do you have to sign up for it?
So there are different parts of Medicare which will help to answer that question. So Part A, that is usually you are automatically enrolled into Medicare Part A when you turn 65. You usually don't have any cost for that as long as you have worked 10 years throughout your life. You would qualify to not have a premium for Part A. So that's typically automatic. Part B, that's going to be like the medical coverage, and we can go more into detail on these things later. That typically does have a premium associated with it. And Part B, if you do not enroll for Part B when you're first eligible, you would have a late enrollment penalty when you do decide to sign up for Part B. So that's something that's really important to know because a lot of people think, well, I don't go to the doctor. I don't really need that much coverage right now. And then they'll wait until they become sick or until they really need it. and then they'll try to get that Part B, and they'll realize that they do have a late enrollment penalty for all of that time that they did not have it.
Yeah, Lauren, we hear that actually at SCAN, people who made that error saying, I'm really healthy. Well, today that's great, but you don't know what tomorrow can bring. So why wouldn't you take advantage of this? So I think that you want to avoid the penalty, and you don't want to wait till you're sick. Absolutely not. So let's just talk about it's time for Medicare. And of course, naturally, you're confronted with 40 bazillion different options. This is, maybe it's only 20 bazillion, I exaggerate. So how do you make these choices?
Yeah, so I think the most important thing to know with Medicare is that it's so unique and personal to you. So a plan that maybe works for your neighbor, or it could even be your spouse because it's that individual,
Right,
doesn't necessarily mean that that will be the best plan for you. So you want to really look into all of your own specific needs. And that's going to be maybe the doctors that you see, what type of care you need to receive, what prescriptions you take, and if they're covered under specific plans. And then how much cost you're able to pay each month or each year, depending. So there's going to be different routes that you can take, different ways to get Medicare coverage. And again, you just want to really think about yourself as an individual, not pay attention to what anyone else is doing, and find a plan that really suits you.
Yeah, it's important. And I'm glad you even said your spouse. Your spouse might have this plan. It doesn't mean it's the best one for you. This is such an interesting situation with Medicare because it really is unique for every individual. I mean, now that, before I was participating in it, and I'm sure most people, you really don't have a concept of that. You almost feel, well, it's Medicare. We're all on Medicare, but it's a unique situation. You want to make sure you choose the right plan, which might mean doing a little research, investigation kind of thing, on your part, not just talking to your spouse or your friend.
Right. Yeah, I would definitely recommend doing as much research as possible. Going to Medicare.gov, that's a really great resource.
Yes, it is.
Especially because it's going to tell you about all of the plans that are out there that are possibly options for you to shop around and really look at what each of those plans consist of, rather than going to like a specific health carrier's website. I think Medicare.gov is a really good place to start. You can even put in there any prescriptions that you're taking, doctors that you see, and they'll kind of help walk you through that.
I think it's also a user-friendly website. I think it's worth making that your first stop. And even if you're already on Medicare, open enrollment is coming up, and Lauren's going to talk about that in a moment. So that's another good place to go to just get some ideas in case you do want to change. So let's talk about open enrollment. First of all, what does that mean?
Okay, so open enrollment. So again, Medicare, I know it seems a little maybe complicated to people. It is definitely overwhelming and confusing, especially one of the things that's kind of confusing with Medicare is there's all these different enrollment periods. But the annual enrollment period, this is what occurs every year from October 15th to December 7th. And this is where everyone who is enrolled in Medicare has the option to shop around, to switch, to find a new plan. You could stay with the plan that you have. You have until December 7th to make that decision. And this is for your plan that will go into effect January 1st of the following year.
So if you don't change your plan, you're automatically going to just be enrolled in whatever you have.
Yes, as long as that plan is still offered within your service area.
Right. So I think it's a unique opportunity, open enrollment, because if you're not happy, if your doctors aren't there, if they don't cover your medication, it isn't like you're stuck. You have a unique opportunity to pick out something else, which I think is pretty amazing. But again, only during this time. But the rest of the year, like if you get married, if you get divorced, if something happens, are there other opportunities? If March 1st, there's a life change for you, can you make a change that way?
Yeah, so that would actually fall under, like I said, there's a few different enrollment periods. That would qualify as a special enrollment period.
Okay.
So with Medicare, it wouldn't really be marriage or divorce because again, this is individualized. But it could be something like you lose your group benefits through your employer. So maybe you finally do retire at 67 and you don't have those benefits anymore. Then whenever that happens, you can enroll in something else that would qualify as a life event if you move outside of the service area, things like that. And again, at Medicare.gov, another great thing about it is there's so many answers to your questions that you can find. So not even things about shopping for plans, but just some frequently asked questions. If you want to find out more about special enrollment periods and things that might qualify for that, you can find all of that on that website too. It can give you a really detailed breakdown of all the different enrollment periods and what they each consist of.
All right, that was Medicare.gov, right?
Yep.
All right. And you know what? I'm going to put that up there so that nobody has to memorize it. You'll see it right on the screen. Because again, it's an excellent resource and it's definitely user-friendly.
Yes.
So Lauren, you kind of talked about this a little bit, but like the parts of Medicare A, B, C, D, and then there's this idea of you could have a supplemental policy or possibly have an advantage plan. So maybe just briefly explain, what does that mean?
Okay, yeah, that's a great point. So with Medicare, basically there's a few different routes that you can take. So original Medicare, that's that red, white, and blue card, that consists of Medicare Part A, which is your hospital coverage, and Medicare Part B, which is your doctor coverage. A and B makes original Medicare. So the issue with that is that original Medicare only covers about 80% of your medical expenses. So this leaves you with 20% responsibility, and there's no cap on that. So if you have a really rough year, you're in the hospital a lot, you don't know how much that cost is going to be. So that's why people choose to either get a supplemental or a Medigap plan to kind of fill in that 20% gap, or Medicare Advantage. So that's the two routes that you can take. So
Lauren, I'm interrupting you because I also just want people to realize that the most basic part of Medicare, there is a fee involved. I wish we could say Medicare was free, but there is a fee that everyone is responsible for.
yes, and that is the Part B premium.
Yes.
So again, Part A, you typically don't have to pay for if you've worked 10 years or 40 quarters. You've been really paying into that. Part B has a premium associated with it. It's based on income. It's usually a flat rate, but if you make, say, a lot more or a lot less than that standard income, then you may pay a little bit more or a little bit less for your Part B.
Right.
That Part B premium is going to stay with you, whether you get supplemental coverage or a Medicare Advantage plan. You're going to have that Part B premium. So that does not go away. And that's that set monthly cost.
Mm-hmm. And if you're collecting Social Security, that monthly cost will come right out of your Social Security. But if
Yes.
you're not collecting Social Security, you can elect to pay it monthly, quarterly, but regardless, there always is that. Okay.
Yes.
And then the supplemental, should you decide, that's above and beyond.
Yes. So the supplemental, that would be choosing a plan to, again, fill in or cover that 20%. So these plans, supplemental, each of the options kind of have pros and cons or a give and take. Supplemental, these plans are standardized. So what that means is whichever carrier you go to or purchase this plan from, the only difference is going to be the price. So the benefits are going to be the same from plan to plan. These are things like plan F or plan N,
yeah,
things like that. And so these plans, basically you pay typically a larger monthly cost to have these plans. The trade-off for that is that you don't pay anything when you go to the doctor. So you're kind of paying in advance as protection, whether or not you use the coverage. You're going to pay that higher monthly premium. You're not going to pay when you go to the doctor. And you can go to any doctor in the country who accepts Medicare assignment. So you're not restricted to any sort of network. That's another benefit. But these
that's a nice benefit. Yeah.
These do typically have a larger monthly premium associated with them though.
Okay. And then what is an advantage plan? Because that's the other way to go.
Yes. So if you don't get a supplemental plan, you can choose to get a Medicare Advantage plan, which is kind of your all-inclusive coverage. It's all in one. So this is going to include all benefits that are part of Medicare Part A and Medicare Part B. Plus, Medicare Advantage plans usually offer a lot of extra supplemental benefits, things like dental, vision, hearing, that's not covered under supplemental plans or under original Medicare. They typically also cover prescription coverage, which also it's important to mention if you do the supplemental plan, that does not include prescriptions. So you would also need to purchase a separate Part D prescription drug plan.
So that's like 3 plans right there. Medicare, the supplemental, and then the drug. Yeah,
Yes.
that's interesting.
Yeah, and you would be paying 3 different monthly payments. So you would have the Medicare Part B premium, you would have the premium for the supplemental plan, and then you would have the premium for your Part D prescription drug plan.
Or versus the Advantage, which is all in one, and then even above and beyond.
Yes,
Very often. Yeah.
it typically covers your prescriptions. Like I said, dental, vision, hearing, plus a lot of plans now offer a lot more supplemental benefits and extras. The trade-off with the Medicare Advantage plan is typically these have very low premiums. A lot of plans even offer, or a lot of carriers offer plans at no extra cost each month, but you will have small co-pays or maybe co-insurance or deductibles, different cost sharing associated with these plans. And that's going to range from carrier to carrier, but that is the trade-off. So you're more so paying as you go rather than paying ahead as you would with the supplemental.
So I kind of look at it that with the Advantage plan, I like how you said that you're sort of paying it as you use it. I mean, if you have 2 months and you don't go to the doctor for any reason, you didn't have to pay anything. Whereas the supplemental, the monthly, that extra, you're paying no matter what.
Mhm.
And, and potentially it's a big chunk of money. I'm not saying one is better than the other. It's just important to realize that you're paying regardless of do you use it or not, versus the sort of pay as you go and have a little extra amount of co-insurance. So that's why it's unique, Medicare. You really have to think about what makes the most sense for you.
Yes, I agree. That's why it is such an
Confusing.
individual
It
thing,
honestly is, yeah.
because you really need to look at your own unique situation and see what works best for you.
Now, but that's why I like the fact that if I choose a plan, and as the year goes by and I find myself saying, I don't think I made a good choice here. So the good news is come open enrollment in October, you will have the opportunity to make a change.
Yes. Yep. So October 15th, I would definitely suggest anyone who maybe isn't happy with their plan, or even if you just want to maybe look around and see what else is out there. Maybe there's something that suits you better that you're not even aware of, or maybe you could save money in certain ways. Definitely shop around October 15th to December 7th and just really do your research and become aware of what is out there and what's offered to you.
And once again, are all the various plans listed on Medicare.gov?
Yes, I believe so. I believe you can find information about each of those through there after you enter your information based on your zip code and things like that. It should walk you through the shopping process.
Okay, because do Medicare plans vary by state?
So it is federally run, federally funded. That's Medicare in general. But yes, the plans like Medicare Advantage or supplemental, that's going to be based by state. And even more specifically, Medicare Advantage is usually by county. So that's why when you put your zip code into Medicare.gov, a plan that shows up for you might not show up for someone who's in another county in New Jersey, because that plan might not be offered within that service area.
All right. So again, just because I live here and you live there doesn't mean we're going to have access to the same plan. Very, very individual. Mm-hmm. So my curiosity is, what are people getting more of these days? The Advantage plans or the more traditional with the supplements?
So again, I don't know. I can't really speak to what everyone's choosing, but I do know that Medicare Advantage is becoming more popular because the one disadvantage, well, not the one, but a big disadvantage that people saw with Medicare Advantage was having to stick to a network. So a lot of people didn't
Okay.
like, oh, I have to make sure my doctors are in this network, or what if I'm somewhere else and I want to go see this doctor? You didn't really have as much flexibility. But a lot of carriers now offer PPO plans, which
Right.
means that you can have both in and out of network benefits. A lot of Medicare Advantage plans now allow you to go outside of the state at the in-network level. So I think that makes Medicare Advantage plans a lot more appealing to people now, that you're not so stuck in that network, which was a lot of people's fear with Medicare Advantage, I believe.
All right.
But again, a lot of people do still have supplemental plans. A lot of people get Medicare Advantage, so it really just depends on what works for you.
So I think the bottom line here is you've got a lot to think about, every one of you out there. And October 15th through December 7th is the open enrollment period. You don't, if you do nothing, you're automatically gonna just, come January, you're gonna have the same plan. So it's not like you have to do anything. It's just that this is your opportunity if you want to make a change. I want to make that clear. It's not like you have to call up your Medicare company and say, oh, yes, I want to continue. They will do that automatically.
Yeah, and they should send you some sort of documentation in the mail around that period, just letting you know things like, this is your plan you have. If you're happy, you don't need to do anything. It's going to vary from what they say from carrier to carrier. Yeah, but typically, if you're happy and that plan's not going anywhere, then you shouldn't have to take any action. But again, even if you are happy, it really can't hurt to just look, see what's out there, make sure that you are in the plan that best suits you.
Because in Medicare Advantage plans do have a lot of interesting little benefits that you might not realize to take advantage of if you don't, kind of go through all that material. And I know the book comes, it's that big. It's not, it's not like you're going to read it right away, but it's worth knowing what you have access to and take advantage of all the services that you could possibly take advantage of. I mean, why wouldn't you? We've been paying into this forever, right?
Yeah. Yep, exactly.
All right. So, Lauren, I really appreciate you coming on today and just giving everyone a little Medicare 101. Remember, October 15th through December 7th. I will put all of Lauren's contact info in the comments. And as you see on the screen, medicare.gov. I think you're going to get most of your answers if you go ahead and go to that site and, go through it and see for yourself. You want to make a good informed decision. And remember, don't rely on anyone else. Rely on yourself for this one. It's important, right?
Yes.
Okay, Lauren Feldman from Brave and Health. Thank you so much for being with me today.
Thank you for having me.
Okay, remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Lauren.
Hi, Andrea.
Take care.